Good morning. My name is Lori or Lorraine McCormick. I am a nursing student in the master's program at National American University for Master's in Nursing Education. This is my capstone proposal review video for course number NS6251. So today is March 5th, 2019, and the purpose of my video or my proposal is to introduce alternatives to opioids in the emergency room where I currently work. I'm a manager of a freestanding emergency room in Centennial, Colorado. So the problem is that in 2016, over 42,000 Americans died from opioid overdose. Now, not necessarily all of these came from prescriptions, as we all know, but we also know that in 2017, 58% of the American population was prescribed a narcotic by a physician. Now, this high number of prescriptions being prescribed allows for increased opportunity for misuse or overuse or overdose of narcotics. So literature shows us that Tylenol and Motrin and other nonsteroidal anti-inflammatories and alternatives to opioids can be just as effective in minor pain control as opioids can be. So if we can utilize things like lidocaine and bupivacaine for wound numbing and infiltration versus prescribing a narcotic for this same injury, then we decrease that opportunity for patients to become addicted or misuse a narcotic. We are seeing an increase in literature in using, like I said, lidocaine and bupivacaine for numbing of wounds, but also using lidocaine for generalized body pain being experienced by kidney stones or for headaches and things of that nature. So we're also seeing an increased use of these agents for nerve blocks. For things such as a hip fracture, we're seeing fascia iliaca blocks where the physicians are going in and numbing the fascia iliaca for this pain control, and it's lasting up to 18 hours versus trying to prescribe or give the patients a narcotic, which can cause an alteration in their mentation process, especially when it's little old ladies that are coming in with these hip fractures and things of that nature. We see oftentimes that they do have an adverse reaction to narcotics in the hospitals. So if we can utilize things like non-narcotic alternatives for things like hip fractures to help reduce the incidence of adverse effects from narcotics, we're also doing our patients a service. So a research article by Angie Draculic in the U.S. Food and Drug Administration study showed that a laparoscopic procedure patient will oftentimes be prescribed 30 tablets of a narcotic postoperatively to take home with them for recovery. And oftentimes this patient states that they only need the narcotic for 24 hours. Now, sending patients home with this high quantity of narcotics just increases the opportunity for opioid overuse and misuse. When this project is going to be taking place, the review is to broaden the knowledge for alternatives for opioids in the emergency room here in my emergency room that I currently manage, and to help educate the patients and the staff, and to seek collaboration with the physicians and the nurses on utilizing fewer narcotics in the emergency room to help combat the opioid crisis and the epidemic. Now, an IRB overview is not necessary since no patients will be actually used during this study. I will just be utilizing the charts of the patients that have already been seen in the emergency room. So there's not any risk to current patients being used during this study. So the method for my project is I will be utilizing my emergency room, which is Centennial Emergency Room in Centennial, Colorado. And our patient population is currently about 40 patients per day, and the majority of them are walk-in patients. However, we do have ambulance traffic as well. And we can see literally anything from the common cold or an ingrown toenail to a gunshot wound. So we see a little bit of everything here. So I will be taking the patient's charts that have been seen for the month of February 2019 here in my emergency room, and I will be obtaining subjective and objective data from their charts, gleaning that information as far as what their chief complaint was, what their pain scale was when they arrived, what our intervention was or what was prescribed for them while they were here in the emergency room, and then what their pain reassessment score was after the intervention. So I will take this data that I glean and help educate the staff as far as alternatives to opioids, that we don't always necessarily need to jump to opioids as the first line of defense for pain in the emergency room, that we can use alternatives as well. Not to say that we will not be using narcotics at all. That's not what I'm saying. We will be using them as a secondary alternative. So trying to go for the least invasive method first. So as a reference tool, I utilized an article in the American Journal of Emergency Medicine. The title of the article was Pain Management in the Emergency Room Decreases Opioid Usage and Maintains Patient Satisfaction. That is a very long title. It was written by a Rachel Duncan and Dawn Stater, who are actually both friends of mine. Rachel is a pharmacist and Dawn Stater is an emergency room physician, that they were asked to pilot an ALTO project, or alternatives to opioids in the emergency room, in their ER, and they found that in 1 year they were able to reduce their morphine equivalent prescription of medications prescribed in the emergency room by 20% in 1 year, and they also were able to maintain their patient satisfaction scores. So my goal is to be able to hopefully do the same thing here in my emergency room, as well as take this to our main campus hospital, where we are the freestanding emergency room for a main campus. So take that to that emergency room as well, and help reduce the opioid crisis that we have in America today by utilizing alternatives for opioids in the emergency room. So in conclusion, my project is alternatives to opioids in the emergency room, utilizing subjective and objective data that I glean from patients' charts that have already been seen in the emergency room to determine what kind of treatment options we have success in utilizing here in our emergency room, and take this information and educate my staff on alternatives to opioids in the emergency room. And I am very looking forward to this project. It's going to be a lot of hard work, but a lot of fun as well. And I would like to say thank you for taking the opportunity to listen to my video, and I look forward to working on this project. Thank you so much.